The top stories tonight in Y News. For the first time in 8 months, the number of new COVID-19 infections in the country went down to the 2,000 level. That could be the reason why presidential spokesperson Harry Roque said the mandate to wear face shields may soon be lifted.
Meanwhile, the Department of Health reports that the decline of COVID-19 cases in the country is slowing down as the DOH projects that active cases may shoot up to 50,000 by mid-December. The government also launched an investigation into the fire that destroyed over 140,000 COVID-19 vaccines in Zamboanga del Sur.
Private hospitals are told to reconsider their threat to disengage from PhilHealth. And a poll watchdog calls for the cancellation of delivery contract awarded by the Commission on Elections to F2 Logistics.
Good evening, Philippines and the world. Today is Tuesday, November 2, 2021. I am Hardin Delgado.
Join us in the next hour as we deliver today's top stories around the Philippines and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. The Interagency Task Force for the Management of Emerging Infectious Diseases, or IATF-EID, is studying the possibility of ending the face shield policy in the country. However, the public should still keep wearing their face shields for the meantime, as there is no final decision yet from the government. The palace said the significant drop in COVID-19 cases might persuade the Pandemic Task Force to withdraw the requirement. Here's an audio statement from presidential spokesperson Harry Roque.
I can confirm po na habang bumababa ang numero, pinag-uusapan na rin po kung ipagpapatuloy pa ang pagsuot ng face shield. So tama po kayo dahil bumababa ang numero, marami nang nagsasabi sa IATF na baka dapat itigil ang pagsuot ng face shields.
For the meantime, Roque advised that the people should still wear a face shield in the 3 C's: closed spaces, crowded places, and close contact settings. On December last year, the IATF issued Resolution number 88, mandating all persons to wear full coverage face shields on top of face masks in all public places to reduce COVID-19 transmission. Meanwhile, a member of the IATF Technical Advisory Group, Dr. Edsel Salvana, backs the plan to the ease of the face shield mandate if cases continue to go down in the country. Let's hear Dr. Salvana on the benefits of wearing face shields.
Alam rin kasi natin na pwedeng pumasok ang COVID through your eyes, and even yung peers natin, kung may COVID kayo, pwede magkaroon ng COVID. So aside from the double layer of protection, yung eye protection is also kind of important.
Meanwhile, independent research group Okta has expressed its support for the non-wearing of face shields inside cinemas. On an interview, Okta research fellow Dr. Guido David said that the removal of face shields will be fine since those who will be allowed to enter the movie theaters are only fully vaccinated individuals. The Philippines recorded 2,303 new cases of novel coronavirus disease or COVID-19, the lowest single-day new infections recorded in nearly 8 months. The last time the Philippines recorded more than 2,000 cases was on March 10, wherein 2,886 COVID-19 infections were reported then. The fresh cases pushed the active COVID-19 infections across the country to 40,786, or a cumulative tally of cases, which was at 2,792,656. Of these, 71.2% are mild, 13.2% are moderate, 7.5% are severe, 5.1% are asymptomatic, and 3.2% are in critical condition. Also, 128 new deaths related to COVID-19 were recorded, raising the total fatalities to 43,404. Meanwhile, total recoveries rose by 4,677 to 2,708,466. Meanwhile, the overall global COVID-19 caseload has reached to 247,129,785, while the deaths have surged to more than 5,638, according to the Johns Hopkins University. The U.S. is the worst hit country with the world's highest number of cases and deaths, followed by India and Brazil.
The decline of COVID-19 cases in the country is slowing down. Meanwhile, the Department of Health projects that active cases in the country may shoot up again by mid-December. Aiko Miguel explains why.
The Philippines and the Pandemic Center NCR remain at low-risk classification. The DOH reported a 14% decline in COVID-19 cases both in the national level and the NCR. However, the DOH says they are monitoring the case trend because the decline in COVID-19 cases has slowed down.
May nakikita tayong pagbagal sa ating pagbaba. It is still going down, but the decline is slower than the previous weeks. There is a decline. Pero pag bumabagal nga, tama ka, yun ay higit nating binabantayan kasi yung pagbagal na yun, posibleng makita natin from a negative, nagpa-positive tayo.
According to de Guzman, it is possible that some areas ease up their active case finding when they see that cases are declining, thus contributing to a slower decline in new infections. Meanwhile, the Department of Health Epidemiology Bureau reports that only Catanduanes, Benguet, Ifugao, Negros Oriental, and the city of Santiago remain under highest alert level 4. Catanduanes is currently at higher risk while the other 4 areas are under moderate risk classification. Under alert level 4, these are areas with moderate to high risk classification and health capacity greater than 70% in the current week.
Pero mapapansin natin na ang mga lugar na to ay merong either a high-risk bed utilization or ICU utilization or para sa mga probinsya ng Benguet, Negros Oriental, and the city of Santiago, both its total bed and ICU bed utilizations are at high risk.
The DOH has also projected that with the increased mobility of people and other factors this holiday season, active cases may reach up to more than 50,000 in the country by December 15.
Kung ang ating pagiging mas mobile ay sasabayan ng pagbaba ng ating adherence to minimum public health standards at babagal na naman ang paghahanap at pag-isolate natin ng kaso, from just 2,100, posibleng umakyat ang mga active cases natin to 49 to 52,000 as of December 15.
However, projections show that even as we become more mobile, increasing vaccination coverage and adherence to safety and health protocols against COVID-19 can mitigate potential case increase. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The overall strategy of the government against COVID-19 includes wider implementation of COVID-19 alert level system. As of now, the efforts have been piloted in Metro Manila as well as some other regions. Rosalie Cos will explain why.
Malacanang reiterated that the government has a plan to combat the COVID-19 pandemic. Presidential spokesperson Harry Roque said part of this strategy is the COVID-19 alert level system being piloted in Metro Manila and some provinces. The government aims for safe reopening.
So hindi naman po sa walang plano, kabahagi po yan ng overall strategy natin. No? Kasama na yung alert level system, kasama na yung kampanya natin for minimum health standards, at saka yung pagbubukas ng ekonomiya.
Also, the palace official did not dismiss the possibility of downgrading the alert level system in Metro Manila. But infectious diseases expert Dr. Edsel Salvania said this has to be carefully evaluated.
Kailangan po talaga natin pag-aralan yan. Alam naman natin na very dynamic naman po ang ating IATF sa pagtingin ng numbers. And hindi lang po yung mga numbers nga sa data drop, ang important po yung mga on the ground po, yung ating MMDA mayors na tinitignan po talaga kung paano nag-behave yung mga tao.
The palace also appeals to the public not to be complacent as COVID-19 situation in the country becomes better.
Na bagamat ang datos ay nagpapakita na po pwedeng ibaba nga po na mas baba pang alert level ang Metro Manila, importante po wag tayong magpabaya, wag tayong mag-isip na tapos na ang pandemya dahil nandiyan pa rin po si COVID-19 at magpatuloy pa tayo at lalo nating paintingin ang mask, hugas, iwas.
Rosa Licoz, UNTV News and Rescue. We serve the people, we give glory to God.
The nationwide rollout of pediatric vaccinations will begin tomorrow. The move to hasten the vaccination for minors was due to the planned gradual reopening of schools for limited face-to-face classes. Janice Inhente has this story.
Following the pilot COVID-19 vaccination of minors aged 12 to 17 in the National Capital Region and the stable supply of COVID-19 vaccines, local government units nationwide will roll out pediatric vaccination beginning tomorrow, November 3. In Marikina City, students can register for vaccination through their schools.
Yung school sa pamamagitan ng mga class advisor ay kakausapin yung mga magulang ng mga bata at yung mga eskwelahan sa pamamagitan ng mga teacher ay nagkakaroon ng mga orientation dun sa kanilang mga klase. Kino-coordinate ng ating vaccination facility. Meron tayong mga naghahanda at nagko-coordinate ng mga schedule na to. At ang pagbabakuna ay mangyayari on a per school basis.
The same registration process applies for minors in other Metro Manila cities. In Taguig City LGU, over 500 minors have received their first dose of Pfizer vaccine.
More than willing, alam ko marami talagang nag-aantay na maumpisahan na itong 12 to 17. So pag yan, makita na nila na meron na nag-start, baka marami na ang ma-encourage na magpabakuna na rin eventually.
Minors need to present a signed consent form from their parent or guardian. They must also be accompanied by their parents or guardian on their vaccination day. Janice Inhente, UNTV, News and Rescue. We serve the people, we give glory to God.
The government has launched a probe into the fire that destroyed over 140,000 doses of COVID-19 vaccines in Zamboanga del Sur. The provincial government is also questioned for its failure to deliver the vaccines 3 days after receipt of supplies as mandated by the IATF. Rosalie Cos explains why.
Thousands of COVID-19 vaccines were put into waste due to the fire that engulfed the Provincial Health Office of Zamboanga del Sur Sunday evening, October 31, 2021. The National Task Force Against COVID-19 or NTF said that the fire destroyed 88,938 doses of Pfizer-BioNTech, 36,164 doses of Sinovac, 14,400 doses of Moderna, and 9,176 doses of AstraZeneca vaccines. Aside from COVID-19 vaccines, other routine immunization vaccines were also destroyed by the fire. The building that was hit by the fire was occupied by different offices and departments of the provincial government, including the Provincial Cold Chain Storage Facility for COVID-19 vaccines, allocated for 26 municipalities and 1 component city. The Health and Interior Departments were tasked to thoroughly investigate the incident. NTF Vice Chairman and Interior Secretary Eduardo Año said the DILG will also issue a show cause order to the provincial government of Zamboanga del Sur for its failure to deliver the vaccines. Based on the protocol issued by the Interagency Task Force, vaccines should be delivered 3 days after receipt of supplies. Año further reminded that safety officers should report 24/7 all issues in all COVID-19 cold chain facilities and warehouses. Authorities are now trying to retrieve vaccines, refrigerators, vaccine carriers, and transport boxes that were not damaged and can still be used. The task force also assured residents of Zamboanga del Sur that the damaged vaccines will be replenished. Rosa Licoz, UNTV News and Rescue. We serve the people, we give glory to God.
For those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook.
The Dolomite Beach in Manila Bay remains closed to the public until tomorrow, as decided by the Department of Environment and Natural Resources, or DENR. But the agency is also considering the closure of the White Sand Beach attraction on Saturdays and Sundays. Asher Kadapan Jr. tells us why live. Yes, Asher, good evening. Go ahead.
Good evening, Will. The Department of Environment and Natural Resources find ways to avoid overcrowding in the Dolomite Beach along Rojas Boulevard in the city of Manila. In its social media post, it assures the public that it is revisiting its crowd management measures in the beach following the overcrowding incident that happened on October 24. This led to its temporary closure during the long weekend where influx of parkgoers are expected. With this, the agency is also considering other measures, either closing the beach on weekends or until the completion of the second phase of its rehabilitation. This will be based on the decision of the Manila Bay Task Force and the alert level status in Metro Manila. The DNR initially announced imposing cinema approach for those who want to visit the Dolomite Beach, where visitors will be allowed to stay within the area for 2 hours, while others are provided stub as they wait for their turn. A special lane will also be designated for persons with disabilities, pregnant women, and senior citizens, but children aged 11 years old and below are prohibited inside the tourist attraction. Well, the DNR is expected to announce tomorrow their decision whether they are going to proceed with the reopening of the Dolomite Beach on Thursday or implement temporary closures of the area. Will.
Yes, thank you, Asher Kadapan Jr., reporting live from Quezon City. Meanwhile, the Philippine Health Insurance Corporation, or PhilHealth, is hoping that private hospitals which are planning to disengage from them will reconsider their decision. Harleen Delgado will tell us why.
The Philippine Health Insurance Corporation, or PhilHealth, maintains that they are always open for dialogue with private hospitals. This comes after Private Hospitals Association of the Philippines Incorporated, or PAPI President Dr. Jose de Grana revealed that 20 to 30 private hospitals across the country are planning to no longer renew their accreditation with PhilHealth due to unpaid reimbursement claims amounting to more or less 20 billion pesos. Most of the unpaid claims were COVID-19 cases from last year. The non-payment of their advances, according to De Grano, has been affecting the operations.
Mating po ang punto na umabot kami doon sa parang deadline namin na gawan nila ng paraan up to the end of October. Parang doon po sa mga pag-uusap ng mga ginawa for the past 2 months po, ay parang wala talagang concrete solution na naibigay ang PhilHealth. Kung sakali po matutuloy ang aming hindi pag-renew ng karamihan ng aming mga hospitals, ay humihingi po kami ng pangunawa at understanding sa ating mga members ng PhilHealth. At talaga pong ginagawa naman namin ang kailangan dapat gawin nang sa ganun po ma-resolve itong problema ito.
The group's president adds PhilHealth President Dante Geran called him a few days ago, appealing for help to resolve the matter. PhilHealth spokesperson Dr. Shirley Domingo says they have paid 152 billion pesos, or 75% of the total claims they have received since last year up to now. The state insurer hopes that the private hospitals will reconsider their looming withdrawal.
We really hope that i-reconsider nila ang kanilang threat to disengage, kasi it will be the Filipino people who will lose, kasi only those who has the capacity to pay ang makakapunta sa mga hospitals na ito. Lahat ng ating regional offices, nakikipag-meeting yan sa mga hospitals doon sa kanilang mga regions. And marami naman, they were able to reconcile the data on claims na talagang in process natin at payables namin.
For his part, Senate Committee on Health Chairperson Senator Christopher Bongo says he and Executive Secretary Salvador Medialdea met with Geran and De Grano, saying that both sides have agreed to work together to address the issue for the welfare of the public. Jorlin Delgado, UNTV News and Rescue. We serve the people. We give glory to God.
The Employers Confederation of the Philippines has hailed the government for opening soft loans for micro, small, and medium enterprises employers to provide for their employees 13-month pay. Nel Marie Buhok details why.
The micro, small, and medium enterprises will now have an options to ensure that they will be able to provide the 13th-month salary for their workers. This after the Small Business Corporation or SB Corp, the financing arm of the Department of Trade and Industry, has set aside a total of 500 million pesos for the soft loans, and this is expected to benefit 67,000 companies.
Tinaasa nila yung pangungutang sa mga maliliit na kumpanya na gusto magbayad ng 13-month pay pero walang pera.
Sergio Ortiz Luis Jr., President of the Employers Confederation of the Philippines, expressed gratitude on the government's effort to help small businesses affected by the pandemic.
At least yung 13-month pay na solve na yun, meron na kuhang pondo.
Last year, the DTI also lent out funds from the SB Corp Cares program to help MSMEs provide the 13th month pay of their workers. The CARES program is meant to assist businesses affected by the pandemic. Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.
The Kingdom of Saudi Arabia is expected to pay the 4.6 billion pesos unpaid salaries of thousands of overseas Filipino workers who were forced to return to the Philippines last 2016. The governments are yet to discuss how the payment will be distributed. JP Nunez will give us the details live. JP, why did the Kingdom of Saudi Arabia decide to pay the unpaid salaries of OFWs?
Yes, Harleen, this was after Kingdom of Saudi Arabia Labor Minister Ahmed Al-Raji appealed to lift the Philippine suspension on Arab mega recruitment agencies which were responsible for the deployment of migrant workers whose salaries and benefits remained unpaid. In return, Dole Secretary Silvestre Bello III assured Al-Raji that the Philippine government would lift the deployment ban once salaries and end-of-contract payments of the OFWs have been settled. Secretary Bello is optimistic that the wages will be settled in December. Around 12,000 to 15,000 overseas Filipino workers will benefit from the wages. However, OWA Administrator Leo Kakdak explains that a series of discussion will still be in place.
Mechanics ng distribution nito ay pag-usapan pa. Sa pagkakaunawa ko, magkakaroon pa ng mga serye ng pagpupulong, lalo na between Secretary Bello and the Saudi Labor Minister, para talagang mas lalo pa mabigyan ng linaw yung implementasyon itong pagbabayad ng mga sahod.
OWA plans to implement financial security for OFWs to avoid the same issue. An insurance policy will be made.
Para magkakaroon ng financial security ang mga OFWs, kakaroon ng insurance na sasala, insurance benefit or policy. Kaya ito na siguro yung sinasabing leksyon na natutunan dahil talagang maluba itong nangyari sa ating mga OFW sa hindi inaasang pagkakataon.
Meanwhile, Harleen, OWA and Philippine Overseas Employment Administration will still mull over the recommendation of deployment ban of OFWs to Kingdom of Saudi Arabia. That is our latest live. Back to you, Harleen.
Thank you, JP Nunez, reporting live.
For those watching us on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook.
For the news abroad, Indonesia approved the first emergency use authorization for a new COVID-19 vaccine called Covovax, which boasts a new technology and is said to play a big role in boosting supplies in poorer countries. Annie Mancilia will give us the details live. Good evening, Annie.
Good evening, Elsie. The new COVID-19 vaccine, which will be manufactured under the Indian company's brand name Novavax, is said to be 90% effective against COVID-19 symptoms and various variants of the virus. The two-dose shot will not require cold temperatures during its storage, which is a key factor for delivery and stocking of the vaccines. It also incorporates lab-developed spike proteins that mRNA vaccines like Pfizer and Moderna do not use. Covovax announced on Monday that it will start rolling the shots within Indonesia. The vaccine rollout is seen as a very important step for Indonesia's COVID-19 vaccine program. According to epidemiologist Diki Budiman, this takes a lot of burden in transportation to the many islands of Indonesia. According to the Ministry of Health, only 36% of the population are double vaccinated, and approximately 58% have received the first dose. An estimated 143,400 deaths from the virus are recorded. This number is believed to be inaccurate due to poor resources and lack of testing and contact tracing. Elsie?
Annie, can you tell us what sort of testing has been done regarding this new vaccine and what kind of side effects does it have?
Elsie, US-based Novavax confirmed that research completed on nearly 30,000 individuals showed only mild side effects, including soreness at the injection site, headaches, and generalized body pain and fatigue. Now, if the rollouts within Indonesia are successful, it will be rolled out in countries where vaccine supplies remain critical. In fact, the company has also filed for authorization of use in the UK, the European Union, Australia, Canada, India, and the Philippines. Back to you, Elsie.
Thank you, Annie Mancilia, live from Singapore. The richest person in the world offers to provide billions of dollars to the United Nations Food Agency. Marvi Delphine tells us why live. Yes, Marvi?
Elsie, Tesla CEO and SpaceX founder Elon Musk said he will sell some of his Tesla stock and will donate the $6 billion needed to solve the hunger crisis of the world if the United Nations can prove it. This came after the UN World Food Program Director David Beasley challenged the billionaires such as Elon Musk and Jeff Bezos in his Twitter post and did an interview with CNN last week. According to Director Beasley, the ultra-wealthy people should step up and save 42 million people on the brink of starvation, where all they need is $6.6 billion. To this call, Musk responded in a Twitter post yesterday that he is willing to offer the funds if UN can detail how it will solve the hunger crisis for everyone to see. Furthermore, Beasley and Musk continue to have exchanges in social media, with the UN director appealing for further discussions in person as he is willing to meet and show the plans to Musk. Meanwhile, the Tesla CEO is now deemed as the #1 richest person in the world with a net worth of about $335 billion based on Bloomberg billionaire data. Elsie?
Marvi, Elon Musk indeed is worth a lot. The $6 billion being requested is only about 2% of his wealth. But will this really solve the world hunger crisis?
Unfortunately, no, Elsie. Director Beasley clarified in a reply to Musk that the $6.6 billion will not solve world hunger completely, but it will save millions of people and prevent geopolitical instability and mass migration, amplified due to COVID and climate problems. Back to you, Elsie.
Thank you, Marvi Delphine, live from Perth, Australia. After years of dilatory growth, property in Christchurch are suddenly rising and quickly catching up with the rest of New Zealand. According to the latest house index, the average property value for all of New Zealand jumped 5% in the past 3 months. The growth rate is smaller and suggests that prices are starting to ease nationwide. But in Canterbury, house prices are continuing to skyrocket. According to a licensed sales consultant, prices were rising faster than he had ever seen before, but Christchurch housing remains affordable despite rising prices. An economist said out-of-town investors were now attracted to Christchurch, where prices were still only half what they were in Auckland and Wellington. A 21-story building, which is under construction in Nigeria's largest city, Lagos, collapsed on Monday, killing at least 5 people and dozens missing. Charisse Longbowen will give us the details live. Yes, Charisse?
Good evening, Elsie. Search and rescue operations are still ongoing at Gerard Road, Ikoy District, where the high-rise building collapsed at around 2:45 p.m. local time on Monday. As of latest Facebook post of Lagos State Emergency Management Agency, 4 survivors were rescued from the wreckage and 5 were recovered dead. The total number of people trapped from the rubble and the reason of its collapse remain unclear. Femi Adesina, the special advisor to President Muhammadu Buhari, said that the president commiserates with families who have lost their loved ones from the building collapse and urges authorities to step up their efforts in rescue operations. Elsie?
Charisse, have there been similar cases to this event that happened in Nigeria?
Elsie, there have been several cases of building collapses in Lagos, Nigeria in recent years. One was in 2014 when more than 100 people were killed when a 6-story building collapsed, and another in 2019 when a school collapsed in the commercial hub. The authorities in Lagos recently launched a new scheme in order to improve their certification. Elsie?
Thank you, Charisse Longbowen, live from Bangkok, Thailand. New studies suggest that improving sleep and nap habits could maximize brain function among the elderly. Jenny Lobos explains why.
Researchers found that afternoon napping for older people may or may not affect cognitive performance. It is determined by timing and regularity. Studies suggest that a nap taken between 1 in the afternoon to 3 p.m. that lasts anywhere from 10 to 30 minutes could be beneficial to improving physical and mental productivity and reduce anxiety. On the other hand, Dr. Abhinav Singh, a sleep medicine specialist and a member of the medical review panel for sleepfoundation.org, stated that napping for longer than 1 hour signals pathological disorders. A study published in the journal General Psychiatry in China tested 2,214 people over the age of 60 through a standardized dementia screening test for memory and language skills or mini mental state exam. The observatory study found that more than 60% of which are regular afternoon nappers and an increase in physical and cognitive health among them. Experts were confident of the benefits of brief naps, but concluded that further research is necessary to address inconsistencies in the studies on sleep quantity and quality. Jenry Lombos, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news in other parts of the globe. I am Elsie Marcos, live from Auckland, New Zealand. Good evening.
A poll watchdog stresses that there is enough reason to cancel the delivery contract awarded by the Commission on Elections to F2 Logistics. However, the poll body says otherwise. Dante Amento tells us why live. Dante, go ahead.
Good evening, Diego. The Commission on Elections said there is no conflict of interest regarding the awarding of contract to F2 Logistics for the transport of election equipment, supplies, and paraphernalia to be used in the May 2022 polls. The Comelec statement came after F2 Logistics is said to be connected with businessman and President Duterte campaign donor Dennis Uy. Contradaya convener Professor Danilo Araw said out of delicadeza, F2 Logistics should also unilaterally withdraw from the deal. But if Comelec would not cancel the contract, Contradaya urges the public to continuously scrutinize the contract.
Patuloy na magbabantay ang mamamayan at syempre the vigilance and the militancy will be there not just on May 9, but even before May 9, starting now, talaga magiging mapagmatyag ang maraming tao.
Meanwhile, the Comelec assures that the logistics for delivery of election equipment paraphernalia will not affect the polls results. There will be final testing and sealing before the election day to determine if there are pre-programmed results in machines' memory. Comelec spokesperson Director James Jimenez added that no instance the logistics can tamper with the election outcome. Comelec and F2 Logistics signed the contract for the 535,999,998 pesos deal on October 21, 2021. Meanwhile, Diego, a petition has been filed before the Commission on Elections today by some individuals seeking the disqualification of candidacy of former Senator Bongbong Marcos. And that's the latest. Back to you, Diego.
Thank you, Dante Amento, for that report.
And before we close, we will leave you with a word, giving glory to God. From the book of Jeremiah, chapter 17, verses 9 to 10, it says, "The heart is deceitful above all things and desperately wicked. Who can know it? I, the Lord, search the heart. I try the reins, even to give every man according to his ways and according to the fruit of his doings." And those are the reasons behind the news, November 2, 2021. I am Herlene Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.
Para magkakaroon ng financial security ang mga OFWs, kakaroon ng insurance na sasala, insurance benefit or policy. Kaya't ito na siguro yung sinasabing leksyon na natutunan.
So hindi naman po sa walang plano, kabahagi po yan ng overall strategy natin. No? Kasama na yung alert level system, kasama na yung kampanya natin for minimum health standards, at saka yung pagbubukas ng ekonomiya.
Dumating po ang punto na umabot kami doon sa parang deadline namin na gawa nila ng paraan up to the end of October. No? Parang doon po sa mga pag-uusap ng mga ginawa, ay parang wala talagang complete solution na naibigay ang PhilHealth.